إن الحمد لله نحمده ونستعينه ونستغفره ونعوذ بالله من شرور أنفسنا ومن سيئات أعمالنا من يهده الله فلا مضل له ومن يضلله فلا هادي له ونشهد أن لا إله إلا الله وحده لا شريك له وأشهد أن محمدا عبده ورسوله أما بعد. Assalamu alaikum wa rahmatullahi wa barakatuhu to all of our dear participants. Myself, Noor Jasra, pursuing my final year at Aspire College of Excellence. It brings me immense pleasure to host you all today. On behalf of Aspire College of Excellence, I extend a warm welcome to everyone here. It would be great to have you all here in this session presented by W Power on diabesity, a modern epidemic, and its impact on our overall health. Things which you will are link between diabetes and obesity, why is diabetes on the rise, symptoms of diabetes, what is diabetes, and how do you prevent diabetes? Now, a brief intro about Aspire College of Excellence and its courses. Our founder and director, Sheikh Abdussalam Al-Madani, quotes, "We stand for integrity and unity of the Muslim Ummah according to the Quran and Sunnah. We aim to produce a generation which is well versed in Islamic studies as well as aware of the modern requirement of the Muslim Ummah." He also says, "I am of the firm belief that progress is possible only if men and women are equally well educated." Alhamdulillah, the primary courses we have at Aspire are BA and MA in Islamic Studies, integrated with Diploma in Islamic Psychology, +2 or PUC course, and our new launch, BSc Psychology. Our courses are accredited by National Council for Accreditation of Education and Therapies and the Tamil Nadu Open University. At Aspire, we also offer e-learning online courses like Basic Arabic Diploma, Intermediate Arabic Diploma, and Advanced Arabic Diploma under the supervision of Dr. Rida Al-Sayed, Professor of Al-Azhar University, Egypt. We also offer Bachelor's in Islamic Studies, which is completely online, where 300 plus students have enrolled and are currently studying, Alhamdulillah. And now about W Power. The vision of W Power is to build a global Muslim community and network for women that enriches their lives and empowers them to be physically, mentally, and emotionally strong. What's the idea behind W Power? We build a safe space, a learning platform, an idea conveyed, and motivation to implement. Each one of you have your strengths and areas where work is needed. We tap the area where we see a resource in you and use it to benefit other women. And we identify where work is needed and support you to build it. Why do we do this? Strength inspires strength. We are of the firm belief that strength can be transferred without diminishing the source of origin by empowering one woman. We therefore empower an entire community, and the reward for it is multifold. Alhamdulillah, we have empowered more than 10,000 plus women who have benefited from our various lectures, workshops, and courses. And we are gearing up to empower many more. Do follow us on Instagram. Today's young generation will be key contributors as our leaders of tomorrow. And Alhamdulillah, our graduates are teachers and educators pursuing their higher education at Medina University, IIUM, Malaysia, and similar other universities. They are also entrepreneurs and lawyers, da'is and social workers, and Alhamdulillah, happy and content individuals. Do take a screenshot for further detailed information about the courses at Aspire. Now, I would like to introduce our speaker for tonight. It's an honor for me to welcome Dr. Khadija Mahmood, who's a seasoned professional with 40 years of experience in clinical medicine. She has gained extensive experience in managing medical emergencies of cardiology, neurology, endocrinology, hematology, gastroenterology, and pulmonology. She has proven competencies in rolling out the innovative administrative strategies to ensure highest level of healthcare delivery. Her experience of facilitating and coaching students by using interactive discussions and hands-on approaches to help students learn and apply concepts in subjects. She is an effective leader with excellent decision-making and planning and people management skills. Alhamdulillah. Over to you, Dr. Khatija Mahmood. The floor is all yours.
Assalamu alaikum and a very good evening. Can you people hear me? Hello? Can you hear me?
Yes.
Yeah. Thank you so much, Noor, for the lovely introduction. I hope I deserve all that. I would like to thank Ms. Ashika as well as Ms. Wafa for inviting me as a speaker. Diabetes is a very huge subject. It is just impossible to cover the whole topic in one sitting. However, today is just the beginning. Inshallah, we'll have many more sessions. And we start off with diabesity. Now, diabesity may be a new term for many of you. You must be wondering what it's all about. It's actually a combination of two diseases. Diabetes on one side and obesity on the other. Earlier, obesity was considered as just an excessive accumulation of fat. But later on, they came to know that it has got its own complications. So the WHO has declared it as a disease by itself. These two diseases, they go hand in hand. You must have noticed that many of your friends or relatives who have diabetes, are either overweight or obese, and many an obese patient has diabetes. Now, before we go to the main topic, we should understand the basics of diabetes and insulin. First of all, we all need energy to survive. This energy comes from glucose, and we get glucose from the food which we eat. For the glucose to be converted to energy, it has to enter the human cell. Now, glucose cannot enter the human cell by itself. It needs the help of an agent, and that agent is insulin. Insulin is produced by the pancreas by a special group of cells known as beta cells. Once the glucose enters the human cell, there are a series of changes which take place, which are quite complicated. Let us simplify it and say that glucose is converted to energy. So when a person develops diabetes, the defect is at the level of insulin. Either there is no insulin at all because the pancreas is not producing insulin, or the cell is not reacting to the insulin. This is known as insulin resistance. So you can define insulin resistance as a condition where the cells do not react to insulin and are unable to use the glucose for energy. So this is the basic. So you can see over here, these are huge big fat cells, and they're not allowing the glucose to enter the human cell. This is insulin resistance. So what happens if a man has insulin resistance? He eats food, gains a lot of glucose. The pancreas, as long as it's healthy, produces insulin. But the cells are resisting the action of insulin. These blue balls which you're noticing are actually the glucose, which is unable to enter the cell. So what happens? The glucose starts accumulating in the blood. If you check your blood sugar, you'll find it's very high. And when there is an excess of glucose, this excess goes into the fat. So although the man has got enough glucose, enough insulin in his body, he's unable to get any energy because of the insulin resistance. So he feels tired, hungry, and starts eating more. So this cycle keeps repeating again and again and becomes a vicious circle. The end result of this circle is obesity. That is the main problem. But please remember, even a lean person does have fat cells. It's not that the lean person doesn't have fat cells. He also has it, but it is a healthy one. It produces chemicals which are anti-inflammatory. They do not harm the heart. But when the person gains weight, the same fat cells become huge, and they also multiply in number, and they produce a different chemical. This is pro-inflammatory, and this can cause cardiac problems. If you open the textbook of medicine, you'll find diabetes is classified into so many varieties. You don't have to know all that. You just have to know the basic types of it. Diabetes, type 1, type 2, and you've got the gestational diabetes, which occurs only during pregnancy. In type 1 diabetes, the pancreas does not secrete any insulin. That is a main defect. But the most common diabetes is type 2. Here we have insulin resistance, as I mentioned earlier, and there's a reduction in insulin secretion. You must be wondering, why is that the insulin secretion is going down? When the person has insulin resistance, the pancreas does its job sincerely. It keeps on pumping out insulin, but it is not effective. So at one particular state, it becomes exhausted, and the cells, the beta cells, start dying, and the secretion of insulin starts reducing. So the person can have insulin resistance, reduced insulin secretion, or a combination of both. This is a beautiful slide which just shows the same thing. You can see here initially the person is normal, he has no insulin resistance, the insulin secretion is okay, blood sugar is okay. But as the insulin resistance starts, it keeps on increasing and increasing unless you put a stop to it. And at a particular stage, when the pancreas is given up, it starts declining in its secretion. So insulin secretion goes down. At the same time, you can see the sugar starts shooting up. This is diabetes in a nutshell. But why are we discussing diabetes? Why not some other disease? There are hundreds of diseases to be discussed. Why aren't we discussing all those other diseases? The reason is the increasing prevalence of diabetes all over the world. It's not just in India, it's everywhere in the world. In the year 2019, we had 500 million people suffering from diabetes, but it has been predicted by the year 2030, there'll be a 25% increase, and by 2045, there'll be a whopping 51% increase in the number of diabetic patients. This is an explosion, and this is what we're trying to avoid. Unfortunately, India is one of the top 10 countries which has the maximum number of diabetic patients. We have to take action. There's no point in just waiting. We just wait till 2045 for the explosion? No, not at all. You have to start acting right away. Another reason for talking about diabetes is one of the leading causes of mortality, of death, all over the world. There are other common diseases like TB, malaria. Deaths do occur due to these diseases. But the maximum number of deaths are because of diabetes. And if you just randomly pick up 11 people, you'll find that at least one person has diabetes. And you'll be surprised to know that 75% of the diabetic population come from the low income and the middle income countries. Why is that so? Because we're talking about obesity, we're talking about diabetes. So what we imagine is that it'll be a rich person who's going to buy all the food on earth and start putting on weight. That is what we think. It's not so. It is a poor man who suffers a lot because he has no access to good food and he cannot afford good food. So what does he do? He works day in and day out. At the end of the day, he goes and buys some junk food from a restaurant and feeds the children and himself because he needs energy to work. But this food is rich in fat and carbohydrates and has no nutritional value. As a result, you will find the laborers who meet every day in life is not really skinny. He's actually slightly plump because of the excessive calories. Now, if diabetes is 1 in 11, you'll be shocked to know that 1 in 4 person is actually overweight or obese, especially in the urban areas. When you compare the rural areas, at least rural areas, they still walk, as far as I know. And another problem is with increasing age, there's also increase in the weight gain. So we should find out why the prevalence of diabetes is increasing. If you go through the internet, you'll find hundreds of factors. They say environmental factors and urbanization, genetic, it goes on and on and on. But let us look at things which we see every day in life. What are we seeing? We are seeing increase in obesity. We're seeing unhealthy lifestyles. And there's also increase in the lifespan. Earlier, man used to hunt for food. He had to walk miles and miles to get his food, but he was healthy. But as we started progressing, it stopped working. Everybody, including me, is found in front of the computer most of the time. We hardly walk. And to add to this, we also order junk food. And this just adds to your problems. And you not only develop diabetes, but you also develop obesity. Now you must be wondering, what is the connection between lifespan and diabetes? Earlier in India, the lifespan was only 30 years because of the poor facilities, no proper healthcare system. But now we have got excellent healthcare system. There's a lot of progress in healthcare. And the lifespan in India currently is around 70 years, which is a very good number. But there's a problem here as well. I mentioned earlier that with increasing age, there's increasing obesity. But after the age of 45, you'll note that the incidence of diabetes also increases. You'll find people getting more and more diabetes once they cross 45 years of age. It plateaus off at 70, but when you grow older, you are exposed to the risk of developing diabetes. Sadly, what we are seeing in the statistics is just the tip of the iceberg. We're not seeing what is under the water. There's a lot hidden underneath. The CDC, or the Centers for Disease Control and Prevention, has shown in the USA, 23% of adults do have diabetes, but they're not aware of it. They've not been diagnosed. In India, it is worse. It's almost double the number, and there are 44 million people walking around happily, and they've not been diagnosed with diabetes, because most of the time, diabetes patients do not have symptoms. So how do we solve this problem? We'll come to that. First of all, you should know what is the risk of developing diabetes. I would like to modify it into, classify it into modifiable and non-modifiable risk factors. Let us take age. We cannot modify age. If you're 45, you're going to become 46, 47, and so on and so forth. You're not going to change it. But if you're physically inactive, yes, you can change that. You can become more active. If you're obese, yes, you can lose weight, change your diet, change your lifestyle. Pregnancy and gestational diabetes is one of the risk factors because later on, these ladies can develop type 2 diabetes. So they should avoid putting on weight after their pregnancy. Family history, you can't change it. It's in your genes, sorry. But blood pressure and cholesterol can be brought under control because we've got excellent drugs in the market. I'll be talking about pre-diabetes in a while. So we should know how to diagnose diabetes. Earlier, we used to just do a dipstick swell, then check the urine, and if the sugar is positive, say, oh yeah, he has diabetes. That's no longer acceptable. We have to do a blood test. It can be either a fasting blood sugar or a postprandial blood sugar, where you take the blood 2 hours after breakfast. So if your fasting is 126 and the postprandial is more than 200, then there is a chance of you having diabetes. I'm saying so because you should always check it the second time. Don't go by a first. Check it again after a few days. If it's still high, above 126, above 200, yes, we do have diabetes. Another method, and the most reliable according to me, is hemoglobin A1C. This is a test which is diagnostic and also helps to monitor the patient. And if it is 6.5% and above, you should consider diabetes, but again, check it for the second time. Now, between the diabetes range and the normal range, you will have another range which is neither diabetic nor in the normal range. That is the pre-diabetes range. The fasting between 100 and 125 doesn't fall in any of these categories. It is neither normal nor is the diabetes range. and the A1C is between 5.7 and 6.4. For those who want to understand what is hemoglobin A1C, this is a test in which the sugar, which is in the blood, gets attached to the red blood cells, and it forms what is known as glycohemoglobin. This result remains constant for a period of 3 months. So you have to repeat it only every 3 months. And it lasts as long as the RBC is alive. The red blood cell lifespan is around 100 to 120 days. So roughly 3 months you can accept this result. This is important because many a patient does not take his medications. But just prior to his appointment, he makes sure that he takes his insulin, takes his medications, comes to my clinic, and then tests the blood and says, "Oh, doctor, my sugar is normal." This is not acceptable because the sugar test which they do in the clinic is just on the spot. It's this blood sugar of that particular time. What we want to know is how was the control since the past 3 months? And that is where the A1C level helps you. Why should we treat diabetes? This is a question most of our patients ask, because a diabetic patient usually has multiple medication. It is tiring, I do agree. It is difficult for them to take. But there's a reason behind controlling your blood sugar. Because when the blood sugar becomes high, it becomes toxic. It starts damaging your blood vessels. If it damages the small blood vessels, it can cause blindness, it can cause nerve damage and kidney failure. Nerve damage is actually expressed as a burning sensation in their hands and feet. Most of your relatives must have told you, "Oh, I can't bear this burning feeling." That is neuropathy. It's because of the nerve damage. And if it affects the huge blood vessels, they can get a stroke, they can get a heart attack, and they might lose a limb. So the reason for controlling blood sugar is to keep away from all these complications, which you can see on the blue side. But we do not control. They can be stroke, blindness, heart attack, and all the possible complications. Now, obesity has its own complications. Even if they don't have diabetes, they have similar complications like stroke, heart attack, breathing difficulty, joint problems. And last but not the least, they can have cancers. They have described around 13 cancers just because of being overweight and obesity. So isn't it important to get rid of obesity? Not only do you get rid of diabetes complications, but also you get rid of all these other complications. Now, this is the main topic, pre-diabetes, which you're all waiting for. Pre-diabetes, as I mentioned earlier, is a level of blood sugar which is neither within the normal range nor in the diabetic range. This is a slide which I borrowed from Dr. Mohan's presentation. It's a beautiful slide. He says, "Don't let the in the pre-diabetes mislead you." It's absolutely true. Because when a patient comes to you to see his blood results, the moment you tell him you have no diabetes, he's so relaxed. He says, "Alhamdulillah, I'm fine." But if he has pre-diabetes, he's not fine. This is what we have to explain. Because once they start relaxing, it can lead to diabetes later on. You have to explain to these people, pre-diabetes is real. It's not a myth. It's common. But the best part of it is it's reversible. It's a golden period during which you can make changes. You can go back to normal. What else do you want? You have got a chance to go back to normal life and normal blood sugar. Do it. And you can also prevent or delay the development of type 2 diabetes. The natural history of pre-diabetes is 13% develop diabetes, 22% go back to normal, and 23% can have death because of the complications. So it is very essential to explain to the patient, he may be in the pre-level, but he is still in the danger of developing complications. So the choice is yours. You want to take the path of recovery, lose weight, control your diet, or you want to go to the path of diabetes and develop the complications, gain more weight. It's up to you. The treatment of diabetes is a very well-known factor. Every one of you can explain to me, I'm sure, what to do. You have to control your diet, take your medications, do your exercise. I'm not going to discuss this at all. The treatment of pre-diabetes is very important. A weight loss of just 5 to 10% can reduce your risk by 60%. It's a whopping big number. Imagine 60% reduction in developing diabetes. This is what we're asking for. A healthy diet, fruits, vegetables, and grains. Don't go for junk food. Go for this. And walk 10,000 steps a day. This is what my patients don't like at all. They literally jump out of the chairs. They said, oh, doctor, 10,000 is too much. It's not too much. You just have to download the pedometer in your mobiles. It's free of cost. Or you can just buy a cheap watch like this. It may cost 3,000 or 4,000 rupees. And wear it all the time. You start walking from the time you wake up, do your normal activities. And by evening, just have a look at your steps. If you have completed 5,000 steps, complete the remaining before going to bed. It's as simple as that. But it takes time. I do understand. Some people take a couple of weeks to come to the 10,000 steps. It's okay. If you're able to do 4,000, 5,000 per day, it's okay. It's a positive sign. Go ahead. Do it. And some of the patients may need medications which will be prescribed by the physician. Our main goal of this lecture is prevention. I do not target a single person or a single family or a single neighborhood. My target is always the community and, if possible, the whole world. But I cannot do it myself. I need your help. I need every one of you to join me in this campaign. All of us together, yes, we can do wonders, but alone, I can do nothing. There are 4 levels of prevention. The first is a primordial level, which starts off in childhood. Children should be taught about healthy food, give them lots of fruits and vegetables, encourage them to go and play outdoors, reduce their screen time. That is very important. And when you go to the primary prevention, it's the same which you're going to continue into. So if you can continue the same healthy lifestyle, excellent, wonderful. Secondary prevention comes when you already reach the age of 45. You're already at risk. So at this stage, it's your duty to screen yourself. Don't walk around happily like an ostrich refusing to see what is outside. You have to face it. You're 45, face it. And screen yourself for diabetes. That is important. And if it is possible, no problem. There are physicians around. They can help you out. So go ahead and screen yourself. Tertiary prevention comes when you already develop the disease, but you can prevent complications. So if you notice, at every level, you do have a chance of preventing further complications. There is prevention at every level. Don't give up. Don't say, oh, I've already got the disease, I can't do anything. No, not at all. You can do something, and everybody should do something about it. Now, I'm sure there are many young mothers who are watching the program, and I would like to mention about the screen time for kids. This is a recommendation by the American Academy for Pediatrics. Under the age of 2, there's no screen time. It is 0. They can sit and watch a video, chatting video with the family for a few minutes. It's okay. But they will not have their own screen time at all. If the child is between 2 to 5 years, 1 hour per day is the maximum. If the child is between 5 to 17, 2 hours is the maximum. But if they have some school assignment they have to complete, yes, the particular day they can have a little excess. Now, when I'm talking about screening, you should know whom to screen. You cannot screen the whole world because it's not cost effective, it's not practical. You should screen people who are at risk of developing diabetes. So if you want, you can take a screenshot of this, or you can follow these things. First of all, every adult above the age of 18 should be screened if he has one or more of these additional risk factors, which are listed here. If the adult has no additional risk factor, then at the age of 45, you better start screening. If the result of the screening is normal, excellent, alhamdulillah, you can screen again after 3 years. But if there is an abnormality like pre-diabetes, please screen every year and do consult a physician. You can do various tests, but the most important test you have to do is the hemoglobin A1C and the fasting blood sugar. You can do your cholesterol, you can do your creatinine, you can do all the tests, it's no problem. But it's very essential for you to do these two particular tests. Now, what are the additional risk factors you're worried about? Anybody whose BMI is above 25 kilograms per meter square, that is, they're overweight or obese, you have to screen them, even if they're only 18 years old. You have to. Age above 45, if they have no complication. If that's their family history, if there's physical inactivity, or the person has hypertension, high cholesterol, if they had a stroke, if they had a heart problem, or ladies who have got polycystic ovary disease, all these people should take care. Screening is ideally done in a clinic. A physician will be the best person to screen you. He can examine you, check your blood pressure, and do your blood test as well. But for those of you who have no time to go to the clinic, I'm going to give you some free tips. You just have to answer one questionnaire, calculate your BMI, and check your waist circumference. You can do it, and you should do it. This is a scoring system by the Finnish Diabetes Association, which I follow, but you can follow any scoring system. It can be Indian, British, whichever you want. It's absolutely no problem. Find out your score. Are you at risk or not at risk? Find out your risk level and take action according to that. The BMI is very easy to calculate because there's a free calculator online. Just feed in your weight and height and you get the BMI. And from the BMI, you'll know whether your weight is normal, you're overweight, or you're obese. Now, this is a measuring tape which I distributed during my previous lecture. Ms. Papa was there, she knows about it. Now, this was a custom-made measuring tape, and my son-in-law spent a lot of money on it. But you don't have to buy this. You just have to buy an ordinary inch which the tailors use. It costs around 10 or 12 rupees. You just have to buy that. And mark the area where the green ends, the orange ends, and the red starts. The green, if your waist circumference is within the green range, you are normal. If you're orange, you're entering the danger zone. And if it is red, sorry, you're obese and you have to take action. These are the normal and abnormal levels of waist circumference. If your waist circumference is more than 102 for a male and more than 80 centimeters for a female, it means obesity. You have to take action. Now, this is a slide which I put in. It shows the risk of disease associated with high BMI and high waist circumference. Now, you've bought your inch tape, but you should know how to measure. You just can't measure wherever you want. There is a method for everything. First of all, you have to relax. Breathe normally. Don't hold your tummy in and don't push your tummy out. Okay? Breathe normally. And then feel for your upper part of the hip. You just put your finger like this and feel for the upper part of your hip and for the lower part of your ribs. Midway between these two levels will be the waist. As you can see here, this is not the waist. this is the wrong measurement and this is the correct way of measuring your waist. The reason for measuring the waist circumference is because there's a lot of fat deposited around your waist. There are two types of fats. One is under the skin, and it is known as subcutaneous fat. And the other fat is under the muscle, it is known as the visceral fat. The subcutaneous fat is something which you can feel. You can just pinch it with your two fingers. You can just pinch it. What you can pinch with your two fingers is a subcutaneous fat. This is a harmless fat. It just disfigures you, but otherwise it's not going to cause any harm. But the visceral fat is deep inside. And this is the bad one. Because it releases certain chemicals which are dangerous, like tumor necrosis factor, interleukins. These are inflammatory hormones, and they can literally harm your heart and cause a heart attack. So because of this, it's better to get rid of the visceral fat. And the best way to get rid of visceral fat is exercise and nothing but exercise. Other danger of visceral fat is diabetes, mental disorders, sleep disorders. It goes on. So, ladies and gentlemen, I'm coming to the end of my lecture. I request every one of you to convey the message to everyone you know, keeping any correct information. I'm not talking any information. Anything correct should be spread. Don't keep it to yourself. Spread it to everybody and prevent diabetes. So it's better to prepare and prevent rather than repair and repent, because once damage is done, it is done. You can't go backwards. You will be going forwards. So that is why you have to take care. And if we put our hands together, we can stop diabetes. It's not difficult at all, and we can do it. Why not? We're all strong people. So thank you for listening, ladies and gentlemen. I hope you enjoyed it. Thank you.
Alhamdulillah, Alhamdulillah. A very, very warm gratitude to Dr. Khadija for your time with us. Jazakallahu khairan, Doctor, for your enlightening message. So, moving on to the question session. We have a question. What is diabetes insipidus? Is it common?
Not at all. Diabetes insipidus has got nothing to do with diabetes mellitus. It's a totally different disorder where the person passes a lot of urine, and the very word insipid means tasteless. So when the urine of a diabetes mellitus patient, which you're talking about, is sweet because it contains sugar. But in diabetes insipidus, it's insipid, it has no taste. That means there's no sugar in the urine. It's a totally different story altogether. There's no connection at all.
So yes, the next question is, my father, mother, and grandparents on both sides are highly diabetic. Is there any possibility that I would get it, and how can I prevent it?
How old is this person who's asked the question? Noor, can you find out?
Ma'am, the name is not mentioned.
Okay. Anyway, I had already mentioned that there are risk factors which are associated with diabetes, and this is one of them. A family history of diabetes is a high risk. So, if the person is more than 18 years old and has one of these risk factors, they have to be screened, of course. They have to be screened. And if the tests are normal, you have to repeat it after 3 years. If the tests are abnormal, you have to consult the physician and repeat every year. So it depends upon the age of the person. If it's less than 18 years, then it doesn't come under me, it comes under pediatrics. But the risk factor is definitely high.
The third question is, my father has severe lower back pain. X-ray reports show L1 and L2. Doctor has advised him to do some exercises and lower his sugar levels. Is it true high sugar causes backache?
I don't think so. I don't think so. Because your X-ray report is not complete. You're telling the X-ray shows L1, L2. L1, L2 is just the vertebra which is present. So is there a problem between L1 and L2? It is purely an orthopedic problem. It's got nothing to do with diabetes. Maybe his sugar was high and the doctors asked him to control the blood sugar. It can cause neuropathy, as I mentioned. It can damage the nerves. And these people do have numbness of their feet and burning sensation, hands and feet. This can occur. But a disc problem is not because of diabetes. I don't think so. This has to be seen by an orthopedic surgeon. Most probably an MRI will be needed.
The next question is, can diabetes occur in teens?
Yes, of course, it can. I have seen children. Of course, I see only children who are above 16 and 17. I don't see children below that because it comes under the pediatric section. Well, if the child is obese, yes, they do develop diabetes. Why not? But I'm talking about type 2 diabetes. Type 1 can occur even in a newborn child. That is a totally different story. We are now discussing type 2 diabetes. Type 1 can occur anytime. But type 2 in a child is possible if the child is obese.
The next question, what are the pre-diabetic symptoms?
The problem is the pre-diabetes will not have any symptoms. That is why I showed you the iceberg. Most of these people do not know they have pre-diabetes. So it is very important for us to screen them if they are obese. I screen all my obese patients because I pick up many pre-diabetes patients because of the obesity. And once they lose weight, they go back to normal. So if there is a family history, all those additional risk factors which I mentioned is there, keep screening. And pre-diabetes, as I mentioned earlier, is a common condition. It is not that it's rare, it does occur. So you have to screen yourself when there's a risk factor. And if you're obese, yes, get yourself screened. Is it done, Noor?
The next question, ma'am. Does intermittent fasting help for diabetes?
It doesn't help for diabetes, but it helps to lose weight. It depends on what you're going to have for iftar. Normally, all my patients gain a lot of weight during fasting. During Ramadan, I find the sugars go haywire. They gain a lot of weight because they eat a lot at the time of iftar. So by intermittent fasting, it depends what type of fasting, what type of iftar they're going to do. If you're going to have a lot, they just fast the whole day and hog the whole evening. There's no point at all. But it doesn't affect diabetes. It helps you to lose weight and helps you to reduce your blood sugars. Yes, it does. If you're doing it the proper way. Yes.
The final question, ma'am. What are the ways to control diabetes?
Well, that is a big subject by itself. It depends how much your blood sugar is, how much damage is done, because it can range from a mild diabetes to very severe diabetes. It depends how many medications you've already started. Because the earlier you start the treatment, the better is the control. And it is always needed to step up the treatment. You just cannot continue. Suppose you've started on one tablet and you go to your doctor once in a year or once in 6 months, and the doctor says, okay, continue same treatment. That's not acceptable anymore. As I mentioned earlier, the natural history of diabetes is loss of beta cells. As the disease progresses, the beta cells keep on declining. They reduce in number. There are no beta cells, there's no insulin. Most of the medications depend upon the pancreas to release insulin. And there are several beautiful medications which don't depend on the pancreas at all. There are different mechanisms, we've got different modes of action. So it is necessary to have a regular checkup at least 3 months, every 3 months. And the doctor should also step up the medication as and when the sugar goes up. They should not repeat the same medication throughout. It has to be stepped up according to the A1C level. Keep on stepping up and keep it under control. It's like a spring. You keep the sugar under control. The moment you leave it, it's going to jump up again. So we don't want that to happen. And they will, if the sugar has been absolutely under control, they will reach a stage after a few years that insulin has to be introduced. Because once all the beta cells are gone, no medication can produce insulin. Because it has to act on the beta cell to secrete insulin. So when there are no beta cells, these particular medications which are acting on the pancreas will be of no help. At this stage, you will need insulin and nothing but insulin.
Ma'am, one more question. How can we bring change in our food plates to prevent diabetes?
Well, it's actually a very good question, but the best person to answer will be a dietitian or a nutritionist. And however, I would advise you to have regular meals. That's most important. Have regular meals and have a lot of fresh fruits and vegetables. Don't go for tinned fruits and tinned drinks, fizzy drinks. These are all full of calories. And avoid snacking in between. Avoid late night dinners. If you can finish off your dinner before you eat, it'll be absolutely fine. You can have a fruit or something if you're hungry in the night. But these are all healthy lifestyle which you should develop from childhood. And if you're able to do it later on, it'll be fine. That is the best way. You don't live on junk food because it's nothing but calories and calories. So if you can live, homemade food is the best. So if you can live on original dals and purials and all this good stuff, why not? You can have a good healthy diet, a tasty food, but avoid eating junks, avoid eating irregularly and late night snacks.
Ma'am, the other question. Can a diabetic person do intermittent fasting?
Well, it depends whether he is on insulin or not. Because during fasting, there is a danger of the sugars going very low. If he is just on, for example, on a single tablet and the tablet is not one which is acting on the pancreas, yes, why not? He can. But if he is on insulin or those medications which stimulate the beta cells to produce insulin, their blood sugars can drop dangerously, and that is not advisable. So it depends on what medications they are taking, and if they should keep on checking the blood sugar during Ramadan, especially. We advise them to check the blood sugar more frequently and stop fasting as soon as the blood sugar drops. Not to wait, for example, if it's just 15 minutes before iftar and the sugar is low, you say, oh, it's just 15 minutes, let me complete my fast. That is very dangerous. So it can be harmful. So it depends on your blood sugar, and it depends upon the medications you're on.
Ma'am, there are many who are asking about your clinic details.
Oh, great. Well, actually, I've been working in Dubai all these years, and I'm planning to start my own clinic in Chennai, and it will be in Kidpok, where my father's given me some property. I'd love to see you all. It'll be a pleasure, and you're all welcome. And we're all, I think we should all work together, isn't it? It'll be a pleasure to see you all. I'll definitely inform you people as soon as it's going to be a few weeks, because my son-in-law is most confident person. He thinks I'm a great person. So he's creating a new sort of clinic. And as soon as it starts, I will definitely inform.
Inshallah, ma'am.
Inshallah.
And Alhamdulillah, once again, a very, very warm gratitude to Dr. Khatija Mahmood for your time with us. So, shall we wind up the session?
Please. And thank you so much, everybody. And thank you, Noor. You've done a great job.
Thank you, ma'am. So, Subhanakallahumma wa bihamdika ashhadu an la ilaha illa anta astaghfiruka wa atubu ilayk. Wassalamu alaikum wa rahmatullahi wa barakatuhu.
Thank you.